Guys, well, we're right at 3 o'clock or a little bit after. I guess in the interest of time, we can go ahead and get started. For those of you who don't know me, hi, my name is Margaret Stuckey, and I'm the Director of Community Impact here at United Way. Hopefully y'all can see my screen. So what the plan for today is, I just wanted to very briefly share some information with you about the United Way pathway grants that are available in 2024. We'll just quickly walk through the information that you need. And for those who may not be familiar with our grants portal, we'll be showing you just a little bit of how to access that. I know this session was scheduled for a whole hour. I doubt we will need that much time. We are also going to be recording this and we'll have it up on our website. So you can share it along with other folks, or for anybody who's not able to be with us today, we just want to make sure everyone has the information that they need if they're going to consider applying for an pathway grant. All right, so just to kind of kick things off, and of course I need to make sure there we go, screen works. For those of you, I know some of the folks who are registered for this webinar are already familiar with United Way or have worked with us in the past, but some others maybe not as much, maybe a little bit new to working with United Way. So we just want to do a little bit of level setting. United Way has a relatively, within the last couple years, new model for funding. Most people are familiar with United Way's old model, which involved having sort of a closed portfolio of partner organizations, and those were the only folks who had the opportunity to apply for United Way funding. That is no longer the case. We are now open, and any 501c3 in our service area is eligible to apply. And our service area for Southwestern Indiana is Vanderburgh, Warrick, and Spencer counties. There are separate United Ways for some of our other counties within our region. These grants are competitive, they are rigorous. For those of you who've not pursued a pathway grant before, I will tell you, this is not like a quick sit down, one pager, do it in 15 minutes type of exercise. But this isn't a federal grant either. This is not going to be that level of rigor, but this is something that we want to give you at least several weeks to work on. So there's a nice runway for you to complete all the information that's needed. These are 2-year grants, and the awards the United Way is able to make in this process. We make fewer grants now than we did when we had a large portfolio of partners, but they are typically more sizable grants. That's something that we are excited about. And the other thing that we want to make sure everyone understands is that all United Way grants and all United Way work roll up to a single focus, and that is upward mobility, which means helping our neighbors, families, children in our community move towards financial self-sustainability, move towards stability in their lives. And that is the larger goal of United Way. We do that with a lot of different things. Some of you are probably familiar with United Way's policy advocacy work, or some of the programs that we ourselves run as a nonprofit like FIDA or K-Camp. But for the most part, we are known as a funder for other nonprofits, and we make grants in really 4 different areas. Social stability and growth is focused on social capital and some family support networking, family case management, and other 2-gen type of programs. Thriving Next Gen is our youth services grant, really focused on supporting partnerships between nonprofits and our public schools. Empowering Employment, that's our workforce development initiative, so really focused on connecting people with jobs and also removing barriers to employment. And obviously, the grants that we are here to talk about, all of you are interested in, mental health. Mental health, this is actually going to be our 2nd iteration of our mental health pathway grant. We made our first one in 2022, and we have been really very happy with that process, and very proud of the grants that we were able to award and the work that was done through them. So this time we're excited it's going to be even bigger and better. But again, keeping that focus on mental health and upward mobility. I think that's a really important piece that I want to emphasize and make sure everyone is clear on in terms of United Way's priority. we know that mental health resources in our community are scarce, and mental health is a really important need across all income brackets. All different types of people are looking for mental health resources, and they can be hard to find. But for United Way, we want to zoom in specifically on members of our community who are low income, who are in poverty or living paycheck to paycheck, and may not have as much access to private services that some higher income folks might have. That is really United Way's priority. Um, we do this obviously because we're connected to our larger mission, which is upward mobility, but also because we know mental health has unique challenges for folks who are in poverty. There's a lot of research on this, which I'm sure many of you are familiar with, but low-income folks, if you are living with that sort of constant stress, that habitual toxic stress of being in poverty, that can have a very, very detrimental effect on mental health. And research shows, not just nationally, but local research as well, shows that low-income people are both more likely to report having mental health symptoms and mental health concerns, and less likely to access care than higher income people. So we know that the needs of the poor, the needs of ALICE population, the needs of those in poverty are very, very important, and mental health is a top concern. So, in order to address this very important concern that we all care a lot about, we have the United Way Mental Health Pathway Grants. And if you noticed in our opening slide, it did say Pathway Grants. So that's something we're really excited to talk to everybody about today. In our first iteration of the grant in 2022, it was small, it was fairly limited. We were really only able to make a very limited number of community investments. This time, hopefully, we'll have a little bit opportunity to do some more. And with that more, we've gotten some feedback from different community partners that we'd like to expand the scope of the grant. And so in the first iteration, it was focused exclusively on direct behavioral health services. We will continue that, and we will have a funding opportunity that does focus on those types of services. But we are adding a second funding track, which is going to be more focused on prevention programming. Now, when I say tracks, to be clear, these are two separate grants. They do have separate applications, and they have separate scoring mechanisms. So they are really, it's kind of a twofer. This is a 2-for-1 United Way mental health funding opportunity. I will also say, because I know people had questions, can I apply for both? And the answer is absolutely. The criteria for each are pretty distinct. So one program, if you offer one specific program, it probably won't fit in both buckets. But if you are an organization that has multiple programs, you can certainly submit multiple proposals. You can apply for either one of these tracks, or if you have multiple programs, you could apply for both. So to just give a little bit more detail on what we're looking for with the direct behavioral health services. So these would be things like therapy, counseling. This year, we're trying to be a little bit more inclusive with also incorporating addiction counseling as a behavioral health service that would qualify for this grant. These types of services are going to be provided by licensed clinicians. We talk about a kind of minimum standard of engagement, and they could be family, group, or individual treatment or counseling or other types of clinical services. So things that really wouldn't fit in this bucket would be things like a hotline or help phone line where your folks are calling in and speaking to a clinician one time, maybe when they're in crisis, but there's no ongoing service to that individual. That would not fit in this grant criteria. Likewise, the service does need to be provided by a licensed clinician. So things like more informal peer support groups or other types of support networks that are done peer-to-peer, not using a qualified mental health professional, those would not fit in this type of grant category. Now, on the flip side, now that we've opened up this second track, prevention programmings are definitely a lot more broad. And we're really excited to see what type of proposals come out of this. This could be a lot more inclusive. It does not have to be programming that's provided by a licensed clinician. So again, right there, it opens it up and makes it much more broad for a different type of service provider. This could look like a lot of different things. It could be workshops, classes, or just any other intervention that builds healthy coping skills, builds healthy awareness of mental health, and allows people to proactively strengthen their mental health. So when they are struggling with stress or other issues that hopefully they have a larger or a more capacity to manage their stress, manage their symptoms, and so that hopefully people do not escalate to the point where they need the intervention of a licensed clinician. So that's really the goal. We hope that maybe by investing in prevention, hopefully we will lessen that overwhelming burden that we know is on our clinicians and our population of providers, because many of them are stretched really thin and there are long waiting lists to access that care. So that is basically the distinction between those two. Now, other details of the grant, and this would sort of apply to both tracks, the specifics of the funding requests themselves. So as I said, these are United Way's grants are sizable. So we do set a minimum request. If your program is looking for an investment that's, $5 or $10 or $15,000, this is probably not the grant opportunity for you. As I said, it is rigorous. It is a competitive process. So we are looking for folks who are ready to make that larger investment or have the capacity to make a larger investment in their program. For the most part, we're hoping to see that these are programs that there is some opportunity for growth or scaling up of a program. We understand in some circumstances it may just be sustaining excellent work that's already going on. That's okay too. But certainly there is a very known preference that United Way likes to support things that are growing and building value in our community. There is no maximum. So the floor, the minimum request is 50. We don't put a maximum request because we want you to be transparent about what you really need. What does your program really need to meet its goals? But that being said, what does it really need to meet reasonable and attainable near-term goals within the next 24 months? So in order to make sure that this isn't a total crazy sky is the limit proposition, we do ask for a dollar for dollar spending plan. So if you say, well, wow, we could really do a lot with $100,000 or $300,000, we want to understand dollar for dollar how you would spend that money over the 2 years. So we don't want to see any proposals where people are saying, I need $500,000, but I'm a little foggy on what exactly I would do with that money. We really want to see very precise spending plans. So that's something to be aware of and to plan for as you're preparing for this application. And another thing to be aware of, there is no fixed number of awards. So it's possible that there could be few large awards, and we would be okay with that if that's, there were really high quality, exciting proposals. There's also no set rule on how many awards will be made for direct behavioral services versus prevention. Our board has said they're just really interested in seeing what comes in and allowing the proposals to speak for themselves. They certainly want to make awards on both sides in both tracks. But again, it's anybody's ball game. So if proposals from direct behavioral services are much more competitive, much more compelling to the board, then those may take more of the award money and a little bit less for prevention or vice versa. So again, we'll have to wait and see. Now, other important thing for you guys to be aware of is the grant timeline. It's open. It is open today. So some of you may have already actually gotten into our portal, and if you're familiar with United Way's grant portal, already taken a peek at this because it did open up today. The deadline for submitting applications is going to be April 5th. So you have several weeks to pull it together. We believe that will be sufficient time. The evaluation process will be going on throughout April and May into May. And we will have recommendations to the United Way board for funding in that June timeframe. So the announcements of the board's decision will be made in late June. And then we don't waste any time. The grant term begins, boom, July 1. And for those of you who worked with United Way before, you may know that's a great thing because that means the money starts flowing right away. So these are 24-month funding commitments. There's a little bit of a nuance to this that I want to make sure folks are aware of. It is a commitment of 24 months of funding, but the reporting for these grants are stretched out over 30 months. And there is a specific reason for that. We will not ask anybody to track data or report on data for the first 6 months of the engagement. And that's because we know if you've submitted a proposal where you said, hey, I've got this great idea, I really want to take our service and bring it to a new community, or I want to take our service and expand it by hiring up more staff, or I have a whole new pilot program that I would like to get off the ground. It may take some time for you to hire, to work through the logistics, to get your ducks in a row before you're ready to start tracking data. So we give people kind of a 6-month grace period where the money will be flowing. You'll have that initial influx of capital to get things off the ground, but you're not quite on the hook for reporting things until you've crossed the line of that 6-month grace period. And then that first report will be then after technically what's been a whole year of the grant term. So that's why we stretch things out in that way. All right, now we want to talk a little bit about the evaluation process. Some of you may be going, well, who is United Way to decide what providers should be getting funding for mental health? And the truth is that I am not an expert in mental health. No one on United Way's board or staff is necessarily an expert in mental health. And that is why we have compiled a really excellent, I believe, absolutely top-notch committee of external professionals to help guide this process. We do this in all of our pathway grants. We call them our expert task forces. And for mental health, our expert task force is a group of really amazing professionals. We have both retired and practicing mental health professionals. So everyone involved in this grant process, other than yours truly, is someone with deep expertise in mental health. We have folks who have many years of clinical practice expertise, folks who have a background in psychiatry. This time we have some folks with a little bit of experience in addiction treatment, and also some folks who have the lens of counseling center or nonprofit management and administration of counseling type of services or other mental health related services. So a lot of great deep expertise in the topic. And you will see they are the folks who helped create the applications. So they help United Way know what are the appropriate questions to ask, what are those smart questions to ask to really understand the nuts and bolts of someone's service. And they also help develop the criteria for scoring responses. They know what to look for in terms of what is best practice, what does a great counseling program look like, or what does a great preventative skill building program look like. So they will be the ones who will be assessing the quality of the proposals. And of course, we always have that second dimension. Obviously, we want to make sure we're funding the highest possible quality services, but like any good foundation or grant maker, we have to consider financial ramifications as well. So all grant applications will also have a financial review component, and that is done by United Way finance team and other volunteers with finance backgrounds who will be reviewing your financial information. And that is for the most part to make sure your organization is sound, it's in good financial health, and so you would have the capacity to take on this type of investment from United Way and steward those monies well. And then ultimately, both of those committees will report their findings into United Way's board. And ultimately, United Way's board is the decision-making entity, but they're being informed by folks with deep expertise in both the financial ramifications of grant making and the actual nuts and bolts of excellent mental health service. Other thing to note, which is a little bit unique about United Way grants. So all of United Way grants are the evaluation of proposals is blind. It is redacted. So that means if you turn in a proposal that has your name and your branding plastered all throughout it, I have the pleasure of going back and redacting a lot of what you've written. And we do this for a very specific reason. Evansville is a small community, and there are some programs out there that are pretty singular in our community, and they may be really easily recognizable, even if you take off name and branding and things like that. But they're the exception, not the rule. Most programs, once you take the name off, one counseling center may sound very much like another counseling center, or one skills group program may sound like another. We believe keeping it blind is a good thing because it's just a step in trying to make sure that the process is impartial and that no one is able to just coast on reputation or brand. They really have to deeply, deeply explain their work and sell the value proposition of your work through your proposal. That hopefully makes things a little bit more of a fair, level playing field. But that's just one thing we wanted to note about our process. Moving right along here, and we will have time to kind of open it up for questions at the end, but just to be mindful of everyone's time, I'm just going to keep going through to make sure we cover all the information that folks need. So kind of last thing before we get to Q&A, I do want to make sure that everyone understands how to access this opportunity. For folks who have a background working with United Way or our former legacy partners, none of this information is new to you. If you are new to partnering with United Way, then sometimes accessing the system can be a little challenging at first. I do want to say, if you run into any technology snags or you're not quite sure how to manage some of these things, please email or call me. We never want the technology to be a barrier. Sometimes these systems are just a little persnickety. We will help you work through it. So just to quickly give people the overview of how to access this opportunity, please go to our website. It's unitedwayswi.org. And if you scroll all the way to the bottom of our footer, there is a button to sign into EC Impact. And that secondary screen, make sure you click the line where it says you are a community partner, a grant recipient, click here. That's how you know you're getting into the grant applicant side of the software. This should look familiar to some of you. I did want to call out this creating a new account. Many nonprofits in the community have received funding via United Way during COVID relief. And if that is the only time that you have interacted with us, you will most likely need to go back in and create a new account for yourself. All of those old accounts that were just for COVID relief have been kind of purged from our roles. And so you may need to go through that process again if you've not already pursued other pathway grants. Once you get in, registering for the grant opportunity is a little bit tricky, so I want to make sure everyone understands what to do. It is a two-step process to gain access to the full application. So once you get in on this home page, you'll be over here on that sidebar. There is a button that says register for new grant opportunities. That's step one of the first process, and you will see we will have both grant opportunities listed. You can select one, the behavioral health or prevention services, and there's several things, screens to click through, continue. These are, as I said, entirely separate applications, so you can't do them both at once. If you plan to apply for both grants, you will have to come back and go through this 2 times in the process. But this first level of connecting your organization with the opportunity is at the agency level. And then once you've done that, you will you'll see you have this first, you can see my fake agency right there. You will have this first set of links available and associated with your organization. And then step 2 of the process is linking the program that you are interested in seeking funding for to the opportunity. There are 2 ways of doing that. If you've worked with United Way before, we may already have your program on file. So there's a drop down here, and if you've already applied for grants with United Way, or you have a legacy partner history with United Way, look in that drop down first and see if we already have your program listed. If so, you can just click assign selected program to this application. If not, you can hit this link that says create new program and assign it to the application. You'll have to provide some just really basic cursory information about the program, give the name and contact information of the primary contact person, but really basic stuff. You will then get to see this lovely little screener here. This is a screener that we use on all United Way grants, and these are just the most basic eligibility criteria. Obviously, you do need to be a 501c3. All United Way grants from Southwestern Indiana are restricted for use in this area. You do have to confirm that you are serving low-income people, and we give our definition of what we mean by that. If you are applying for the direct behavioral services grant, there's this additional criteria stating that the services are in fact provided by a licensed mental health professional. If you are applying for the prevention grant, that criteria will not be listed. But you need to be able to say yes to all these things to be eligible to apply. If any of them are no, then this is probably not the grant for you. And this is the screen. This is what it will look like once you've gotten all the way through it. And I know that looks long. That looks like a lot of links to click through, and it is, but it's really not that bad. I assure you. So the first stuff, just your basic organizational information. We'll ask you a few questions about volunteer opportunities to upload your financial documents. For both tracks, the direct service and prevention, we're going to ask some questions just to help to get to know your program model. You will see that, ooh, lost my cursor. There we go. We have kind of some two links here that look pretty similar. Client profiles current, as in we're asking about your demographics and some other particular questions, especially on the direct services side, about getting to know who are the folks that you're serving. On the direct behavioral health, we're going to ask some more detailed questions about the types and severity of mental health concerns that are being addressed by your service, and some questions about the typical duration of the service that you're providing. For the prevention services, it's a little more just focused on demographics, things of that nature. The service history and goals is pretty straightforward. For the most part, we're going to just be asking about historically, how many people are you able to reach with this program? And if you are awarded a grant, what would your goals be for the future? So there are a few places throughout this proposal where you have the opportunity to get a highlight what you would do with a United Way investment, get to really explain the value that a United Way investment would bring. This future client profiles, one of the things that we would like folks to highlight is if with the United Way proposal, you're trying to do something new, and that new thing may ultimately make your demographics in the future be a little different. So perhaps you are trying to bring your service to a new location in a new county, or you want to partner with an organization that is really deeply embedded in serving a community of color that you don't currently have relationships with, or you're really going to focus on doing outreach to serve more low-income people. We give you the opportunity to kind of update those future states. So if I have a United Way investment, this is how things will look different in the future. If that doesn't apply to you and you're really just focused on keeping your program as it is or continuing to serve the same types of folks that you've always served, there's just a button where you can go, this does not apply to me, and no anticipated change. The current spending and requests, so this is where we will ask for that really specific dollar by dollar spending plan. We do ask for the kind of current historical spending that you've done on this program. And then we give some narrative opportunities for you to walk us through in detail. When I say we need this much money for salaries, well, this is what I mean. These are the positions that it would be funding. Or I say I need this much money for supplies. Specifically, it's it's licenses for this this software that we use that's really important for our clients. So we do ask for a little bit more detail. We'll also ask some questions about the sustainability of your program. Obviously, this is a 2-year grant, and there is no guarantee of ongoing sustaining funding. So we do ask questions about your other funding sources, your capacity to maintain your service levels, or if United Way makes an investment to help you scale or grow, what plans might you have in the future to sustain that new level once United Way is able to help you take it to the next level. So that is the totality of the grant. I will say, for those, again, if you're not familiar with this grant software, you do have to go in and kind of mark each form as complete and say, yes, I confirm I'm done with this form. And once you've done that for absolutely every form, then a big submit the grant application now button will appear at the top. A few other things of note there. When you're ready to submit, it will ask you for I believe, the date of the board meeting where your board gave the okay for this. That has freaked some people out in the past. Just to show what we mean. Typically, pathway grants are not small asks. These are getting to be 6-figure grant commitments oftentimes. And United Way does not want to get sideways between an organization and its board. We really know that that's important. If you haven't had a board meeting or you don't have one coming up between now and the time you submit this grant, that's okay. We just want to know that you have run this by your board. They're aware that you're submitting this proposal, and they're aware of what you're requesting funds for. So if you have some very ambitious plan to start a new pilot or scale a program in an entirely new way, we want to make sure your board is on board with that. So just mark the date where you've more or less gotten there okay with that. Doesn't really have to be a board meeting, but just confirm that in that field. And then obviously your executive director or CEO would need to sign off on the submission as well. And that is really the whole thing. Oh, another thing I almost forgot. I always like to share this with people. It's a tool I find really helpful. I think other people use it too. Once you get into the portal, this resource center, I do provide the full application rather than clicking through all of those little links like one at a time. And sometimes they're just onesie-twosie questions per link. We do provide the entire application in a Word document so you can draft outside of the software. I write grants too. I know nobody actually likes drafting a first round in the software. Nobody does that. So download the full application Word document for each of them if you want to, or whichever one you're focused on. And you can see all the questions at once and start working on your answers. We also provide the poverty guideline tables, because several points throughout there we're going to reference low-income populations. We're defining that as 185% of the poverty line or below. And so if that's not specifically what you are using to track income with your population, this will give you a good reference point. So that's an important one to know. And then the last thing I want to talk about, I like to I want to make this as painless as possible. We do ask for a lot of information. We're going to ask some really detailed questions about your service, but we also want to make this approachable. So for all pathway grants, United Way offers office hours with me. Hi, Margaret. I am not the one who is actually scoring your proposal, so I have absolutely no problem sitting down with you and coaching you on it. So if you have questions and you say, I'm just really not sure what this question's getting at. What information are they really trying to get from me? Or what is it that the board is looking to understand with this question? Shoot me an email and we can set up some time. If you're especially with the direct services, things are pretty cut and dry and clear. For prevention programming, people may be bringing proposals that are, a little outside the box. And you may be thinking through whether or not a program is an appropriate fit for this grant, or trying to articulate how you feel your program meets the goal of supporting mental health. We can sit down and talk together, and we can work through some of that. So reach out to me. I do set aside time to have these meetings and give people that support so that you are able to turn in the most competitive proposal for your program, and that when it sits down in front of that expert task force of mental health folks, you are really showing yourself off to the best advantage possible. So that, I believe, that's everything. That's the whole shebang. And we definitely didn't need an hour. See, but we were maybe a slightly over half an hour. So it's good we gave ourselves that generous timeline. All right, folks, this is where I will kind of open it up to questions. And I've got a friend here supporting our technology needs. I think everyone should be able to take themselves off mute and just speak up if you have questions. I believe we've got the settings of this Teams meeting able to do that. So I'll just give it a second here if anybody has questions. Yep. Yeah, or if you prefer, you can pop a question in the chat. All right. Thanks, Laura. So does it look like anybody's got too many questions? This is always my favorite part, just sitting and waiting. All right, well, folks, if there are no questions, that's fine. If you do think of something later, email me, call me. I will be in touch. We'll make sure that this recording gets up on the website and that you have access to all the information you need. If you run into trouble accessing the portal, please certainly reach out. We don't want that to slow anybody down in this process. All right, thanks very much, everyone, and we're really looking forward to receiving your proposals. Have a great Friday.